Okay, hello everyone. My name is Jason, and along with my coworker Tracy, we'd like to give you an overview of the Charge Module for TouchWorks EHR. Before we get started, I'd like to take a moment to remind everyone that your lines have been muted to avoid any interruption today. Also, please direct your attention to your WebEx screen at the bottom right-hand corner of the page where you'll see a panel labeled Q&A. Feel free to submit any questions you have during the presentation regarding the Charge Module right there. We may or may not be able to get to those questions today, depending on how much time we have after the presentation. Any questions we're not able to get to, we'll respond to, and we'll also provide the slides for today's webcast on the Galen Wiki within the next week. The information can be accessed by clicking the webcast link for today. Also, I want to do a quick introduction for myself and Tracy. I've been working with Galen now for just over 3.5 years. I'm a consultant here. I have a degree from Point University, which is located in West Point, Georgia, and I started my career in finance and then made a career change to healthcare IT when my wife and I moved to Chicago in 2012. My coworker Tracy is a senior consultant. She's been with Galen for just over 4.5 years. After she graduated from Ohio University with a degree in Management Information Systems, she completed a vocational education certification, and then she spent the next 5 years teaching at Wellston High School. In 2006, Tracy changed directions career-wise as well and became involved in healthcare IT. All right, so with that, with housekeeping and introductions out of the way, let's go ahead and get started. I want to take a look at today's agenda. And in doing so, we hope to provide you with a more in-depth understanding of the TouchWorks EHR Charge Module. We'll touch on some configuration points you need to keep in mind and also try to give you some insights into why it can be beneficial to your organization. The first item we're going to touch on today is the benefits of implementing Charge. Then we'll take a look at organizational issues you can expect to encounter. We'll also take a look at how Charge Module works. We'll take a look at how we implement Charge. Then we'll look at preferences and how their settings will affect your organization. And then also we'll take a look at planning your implementation and then some miscellaneous items to consider and discuss. So let's dive in here and take a look at the benefits of implementing Charge. First off, your organization will see an increase in revenue and accelerated cash flow. You can expect fewer lost charges, reworks, and billing mistakes, and let's cover how. The electronic completion of billing eliminates the possibility of losing paper charge tickets, resulting in fewer lost charges. Also, the elimination of paper charge tickets means doctors will perform fewer reworks for tickets marked with illegible handwriting or that were filled out incorrectly. Also, the Charge Module helps reduce the occurrence of improperly filled out superbills because it's designed to prevent users from submitting charges they may have forgotten to input required information for. Also, the reduction of billing mistakes because practices no longer have to worry about the risk of human error. That is an inherent facet in the common process where charges are translated from a paper charge ticket into electronic billing systems. The Charge Module also has built-in rules logic that helps organizations drastically reduce billing mistakes and the risk of regulatory noncompliance. Another benefit is the faster submission of charges results in faster reimbursement. Once the provider has completed the electronic bill, charges are sent to and then reach the billing staff immediately, thereby decreasing the posting to payment time from days or weeks to hours. And this is consequently going to result in faster reimbursement. Now let's take a look at some improved efficiencies that the Charge Module will provide for you. First off, the elimination of dual entry. That is the translation and entry of paper charge tickets into the electronic billing system. This allows billing staff to use the gain time on coding and review more encounters. This can potentially enable practices to increase the number of patients seen or charges generated without increasing the number of back office full-time employees. Centralized charge and encounter data. All charge and encounter information is located online in one centralized place. This means no more chasing down paper encounter forms months or years later. And so you might ask, is it accurate? And yes, it is. You can update something in the system and the info will automatically be updated on all charge bills system-wide. It used to be that you had to go back and gather all the paper super bills and correct them individually. And then we've got reminder tasks auto-generated for providers. This is done with a system preference that can be set when a patient has arrived in TouchWorks EHR. A reminder task for submitting charges is then auto-generated. This means that the back office staff is no longer going to have to manually track or remind providers to complete the charging submission process. Then we've got easy immediate updates to encounter forms. Electronic encounter forms undoubtedly offer more flexibility, as you'll get new codes for use by providers. The other ones can be added, deleted instantaneously within the charge module. And then finally, we've got enhanced personalization options. This facilitates better efficiency by allowing providers to create personalized favorites for diagnoses, visits, and procedure codes. It gives providers the ability to build subgroups for better organization and arrangement and faster access to the most commonly used charge codes at their particular site. So now let's take a look at some of our organizational issues that you'll need to address before you move forward with your charge module implementation. First off, we've got change makes end users uneasy. And undoubtedly with charge module, this is going to be a big change for your organization. So it's important to acknowledge those concerns and address them individually with thorough testing while always remaining cognizant of these apprehensions. I know I've personally worked with clients who have had bad experiences involving changes in billing in both the paper and electronic workflows, so be sure to emphasize the positive aspects of this implementation and use these concerns for testing plans. Next, we've got widespread effects through the organization, and mainly I want to talk about the effects that we have on money. This is going to affect a lot of people in the organization, your administrators, your providers, and your business office. Management is always going to be concerned with meeting budgetary outliners. Providers' reimbursement may well be tied to submitted charges, and of course the very purpose of the business office is to submit and work claims in a timely fashion. So all of these groups are going to have a vested interest in our process. Next, we've got it's not going to fix a bad process, but it is a way to bring poor workflow to light, and it's an opportunity for us to examine and redesign. Quite often in a complicated process such as charge submission, there are going to be many steps to get a claim processed by your organization. It's not uncommon for staff to become a bit specialized in a particular piece of the puzzle and not realize all the other steps folks are taking before and after them. So this may be a great time to take a look at the process as a whole and identify areas that can be streamlined by reducing redundancies and possibly redesigning workflows. And then we've got the need for testing and planning cannot be overstated. Again, this is a big change that tends to cause anxiety organization-wide. So nothing can quell those fears as much as thorough testing and planning. No one wants to be scrambling around trying to process claims and generate charges at the last minute. So know your current paper process, work with the appropriate staff throughout the organization, and develop inclusive testing plans. And then we see involve end users from across the organization. That's going to include your providers, your clinical staff, your administrators, and then obviously your billing office there. We see work closely with clinical staff early in the design process. Again, knowing the current paper process and identifying how to best convert those processes to electronic workflows is going to make this a much smoother transition for you. Identify those end users in your organization who will review encounter forms, who will actually submit charges. If there are questions on submitted charges, who's going to address these? Is it going to be the individual provider, the nursing staff, or maybe even your practice manager? And then lastly, we see their periodic review and process modification. So as much as we try to prevent surprises, there are going to be issues that pop up periodically that we may not be part of our normal workflow of the office. Remember to be flexible and work through these issues. And of course, best business practice indicates every organization should periodically be reviewing their process and modifying them as needed to gain the most value from staff and their workflows. All right, so now I'm going to hand this over to Tracy to take a look at how the charge module works.
Thank you, Jason. 1 second here. Let me share my screen. Are you able to see my screen, Jason?
I can see your screen.
Thank you. All right. Maybe we can get something going. There we go. Okay. All right, so let's go ahead and let's have a little talk about how does the charge module actually work for the end users. So first of all, what happens is there's an appointment that's going to be made in your practice management system, and it's basically going to reside on the provider's schedule in a pending status until the date of service when it's going to be arrived. And upon arrival of the patient, the appointment is arrived in the practice management system, and obviously an interface message is going to flow through the interface over to the application, triggering 2 events within TouchWorks itself. The first thing it's going to do is the appointment updates from a pending status to an arrived status, and now shows arrived on the provider's schedule. And the application will also create what's called a submit and counterform task for the provider, the scheduled provider. And this is a preference that we recommend you highly set up. We'll talk about preferences a little bit later in the webcast. Let's just actually hop over into the application. And you can see here, this is actually what it would look like. I've gone ahead and built out a little bit of a schedule for our provider officers here. And you can see here we've got Allison. She's been arrived. So is Betsy. And, of course, Diane's been arrived. And like I said, it also, let's find our tasks here. For Allison, we should, of course, have a submit and counterform task been arrived that's been generated with the arrival of her appointment. And you can see that's right here as well. Okay, so let's think about how this actually works from if we're going to be working from within the note. So let's get back to our schedule, and I've already went ahead and started a note for Allison today. And we've just done some basic problem assessments and did a little bit of review of systems and physical exam. So as you can see, I've gone ahead and checked a few boxes here in our review of systems. I've assessed a few problems for her. One, of course, is anxiety. And then you can see I've also done hypertension and a type 2 diabetes. One other thing I want to point out while we're looking at this screen are these little HCC icons, and we're going to talk about that a little bit later on, but I just wanted you to have a frame of reference as to what we might be speaking about here in a few moments. So just keep these in mind as well. Again, I've come in here and done a few things on her physical exam, and then we have our assessment, of course. So basically how this works is we want to make sure that we've got one preference turned on, and that's our post to encounter preference, as you can see right here. And what that does is it allows all the problems that we discussed to go ahead and flow on over to the encounter form that we're going to take a look at here in just a moment. It will also, if we decide to use our E&M coder, if we've got this set up and configured appropriately, it will allow for our E&M coder to go ahead and generate the recommended code. In this case, I would recommend a 99213 based upon the level of documentation I've actually done in this note. Again, you can go ahead and override, like maybe we want to say, I really did an extended documentation on my HPI, and maybe the problem risk was a level 3. Then I can ask it to recalculate, and now it says I can use a 99214. So basically, your E&M coder is your evaluation and management coder. And if you, like I said, if you set this up correctly, this too will also flow over to the encounter form. So some of you might actually be wondering what is an E&M coder, and it's just a mechanism to help provide decision support for your clinicians by assisting in the review of the clinical note and helps them determine the level of service for this particular encounter. Documentation made by the provider in the note authoring workspace that basically populates down into your E&M coder. And like I said, you have the ability to come in, review, and or make edits. Maybe you feel like you didn't code it quite as well as you wanted because you didn't hit discrete data points, so you can prompt it to document higher and or lower as well. Okay, so if we click OK here, we can see we should have these 3 problems, and we should have an office visit code. So let's hop over to her encounter form for this visit. Let's close this out. And you can see here we've got our encounter form. In just 1 second, it should populate for us. And as you can see, we've actually ended up with 2 office because 99213 was actually put on there from yesterday. So we can come in, we can edit any of these things. We can reorder. You can see our 3 diagnoses are here as well. Maybe we decided, no, we really don't want that 99213. We really want the 214, so we can just come right in here and remove the charge. Other things to point out here, we've definitely got our billing performing provider coming over with our appointment. We've also got a division, billing area, and location, and that's the mapping that takes place on the back end, and we're going to take a look at those in just a second. So ideally, what you want to keep in mind when we're talking about the process of populating and submitting using counter forms is our patient is registered within our registered and scheduled within our practice management system. On the day of the appointment, the patient is going to be marked your eyes. It's going to translate over into our schedule for the day for the provider. The physician can actually come in and enter some charges, and then our charges can be reviewed or invoiced. You might wonder how they're going to be reviewed or invoiced. So if we unclick this hold for more charges, and we hit submit, and 1 second, you can come back here to our task list with Oscar, and you can now see that our submitting counter form is now resolved itself with submission of that encounter form and clicking of that button. And now we have a review encounter form task for our billing and our coding department to review. So that's basically how it'll work. So I'm going to hand this back over to Jason so he can talk about some configuration on the back end. And 1 second, Jason. There you go.
All right, thanks, Tracy. Let me go ahead and share my screen here. Make sure everybody, you're able to see my screen, Tracy?
Sure can. Go ahead.
All right, thanks a lot. First off, I want to just go over the workplaces that we'll be covering on the back end of the application today. First off, we're going to look in TW Admin. For Charge Module, that's where we can create, edit, and change our groups. We'll also look at how we can manage enterprise org and site info. We'll also talk about charge-related dictionaries in this workplace, and then also user setup and security. Within the admin section, this is really where we set a lot of the preferences related to charge. So we'll touch on this section as well. And then I don't think we're really going to spend any time in phys admin, but just wanted to cover real quick. This is also another place where you can do some of the work that we do in group admin for exploding sets, modifier groups, and subgroups. And also favorites. Now I'm going to hop back over to TW admin, and we're going to go ahead and take a look at group admin. So the first tab we have that populates here is the Groups tab, and this is where we can add and delete groups. And when I say groups, I want us to kind of think about groups as specialties. It's really, what the front-end users are going to think of them as their specialties. So I'm going to click on the cardiology here first, and just let you see what pops up here. So first off, we've got the CPT-4 modifiers, which we'll talk about a little bit more when we talk about dictionaries. So we can see the CPT modifiers for the cardiology group. The first ones here are pretty generic, and then we may have some that are a little bit more specific to cardiology down here at the bottom. And then if we come over here to diagnosis, we can kind of see exploding sets, which we'll get into in just a little bit, and then we've got cardiology, diabetes, cardiology diagnosis group 1, and then cardiology fractures down here. And what these subgroups, which is what we're going to talk about on our next tab, what they allow us to do is just kind of basically put some information into a more specified category. So it makes it a little bit easier for the provider to actually go out and find, hey, I'm looking for something in cardio diabetes, so now we've got some diagnoses that are linked just to diabetes, so it makes it a little bit easier for them to find stuff. So now I want to come down here and just kind of touch on the buttons that are provided for us on this tab. We've got the new button, so if we needed to add a new group or specialty in here, we just click new. We can add that in right there. And then we've also got the delete groups. Say if we needed to get rid of pain management, I could highlight that and then just press the delete group button. That will delete the groups from the from the Groups tab here. And then let me hop back up here to cardiology real fast and just show you this print function right here. This is really good for if during your implementation process you want to sit down and talk with your providers, maybe your billing staff. Obviously, you're probably going to show them how things work in the application, but this basically gives us an opportunity to see how everything under a particular specialty is built out. So when this populates here, we'll be able to see everything that's tied to the cardiology specialty here. So we can see all of our subgroups, any kind of exploding sets that we've got in here. They're all built out right here. All right, so I'm going to click out of this, and then we're going to go ahead and go over to subgroups. And then I've got an instance of the front end of the application because I want to just kind of show you guys where this looks, or where these items actually show up. So we've got diagnoses. When we're building out subgroups, we're going to be talking about pediatrics today, so you'll actually see these on the back end, but I want to show you where they kind of show up on the front end of the application. So for our diagnoses, obviously they show up in the diagnosis tab here. Procedure charges. Give it just a minute here to load. We've got a couple here built out for our demo today. You also see modifiers here, so we'll talk about those as well. And then visit charges. We'll see those grouped out as well for us, as well as some modifiers here just as soon as it loads. All right, so let's now that we've had a chance to kind of look at where all this information is actually going to be going, let's go ahead and hop back over to the back end of the application and take a look at a little bit of this. So first off, we're going to take a look at the diagnoses. We've got a few that have already been built out for us. For our subgroups, we've got peds cardiology demo, fracture demo, and newborn demo. And right now, I just want to take a moment to kind of point out that we've got a standard naming convention here. And this is really important. You want to have a standard naming convention, and you want to stick with that standard naming convention because basically when you've got folks that are going in and maybe building a new specialty, or you've got people going in and doing maintenance, you want to have this stuff to where it's very easy for your for folks in the organization to actually find the information. So come up with the standard naming convention and then have everybody stick with it. So let's take a look at the pediatric fracture demo, just to kind of go over the different buttons and everything that we can do in here. So again, we're under diagnosis. Our name is pediatric fracture demo. We've got a display name here that's the same. If we wanted to update that and change it, we could. And then we've got this view right here. This allows us to, the master view allows us to search the IDC-10 and problem dictionary to find problems. And then we've also got all of our other specialties. So let's say I knew I had a fracture in cardiology that I wanted to add over here. I could just literally come over here and I've added it in. So it's pretty simple. If you've got it over here, you just click it and pushes it right over there. Now let's say I wanted to just take that one I put in and remove it. Your remove button, you just highlight the item you want and remove that. And then also we want to talk about assigning groups. So right now this particular subgroup is only assigned to pediatrics. Let's say I wanted to add family medicine to that. So I've added family medicine now. And then again, if I wanted to get rid of the family medicine, I just highlight it, click delete, and it's gone. And we've got a few other buttons down here at the bottom. We've got the delete subgroup and the save. Just want to point out that these are really close together. So if you're wanting to save your work, make sure you're on the save button. If you click the delete subgroup, you're going to lose your information. Definitely don't want to do that. So make sure you've got it on the save button. So we'll save what we did here. And then I want to take a look at the procedure subgroups. And again, we've got our standard naming convention, pediatric immunization demo, and wound care demo. So we'll just take a look at the immunization. And looks fairly similar to our diagnosis subgroup section. We've got the name, the display name, adding a specialty or group here. And then we've also got down here just a code for procedure here. Now the one difference we have down here is we've got the edit display name. So if I wanted to click on that, I can actually change the display name. It gives us a warning letting us know this is going to be a system-wide change. So we'll go ahead and click through that. And then let's say that I just wanted to add demo on this. All right, now we've changed our display name, so it'll read out a little bit differently. And then we've got the same buttons down here as well. And then lastly, I want to take a look at our visit charges. Again, we've got a few things that are built out for us. I'm sorry, just one thing here, pediatric established office visit demo. So let's open that up. Take a look. We've got all of our established office visits. So let's say we wanted to actually create a new subgroup here. So I'm going to click the new button, say OK. Just go ahead and paste that information I just put in there. And then we're going to call this new, so we can actually have some new office visits. And we'll copy and paste that down there. I can just come in here, I type in new, and it's actually going to show us all of our new visit codes. So all I have to do is just click on each one of these, and it's going to add that into my subgroup here that I'm building out. So I've got all my codes. I need to make sure that I add my group that I want this to be tied to. So I'm going to add it to the PED specialty. Click OK. And then if I needed to, I could again edit the display name. We're not going to do that. We'll just go ahead and click Save. And now we've got a PEDS new office demo for the provider on the front end that they would be able to use. So now let's hop over to the Exploding Sets tab and talk a little bit about what exactly exploding sets are. So exploding sets are useful, first off, for practice areas where you're typically documenting or performing a set of related diagnoses or procedures in a single encounter. They can be used in conjunction with charge-related functions on the encounter form that can include multiple diagnoses, visit charges, or procedure charges. Some of you might be asking what exactly is the exploding set, and the easy answer is it's a quick way to document a set of related diagnoses, procedures, modifiers, and/or office visit codes on your encounter form. When you select the exploding set, all the items that are included in the set are automatically added to the encounter form. And these work really well for those instances like immunizations, where you have the same action, therefore the same charges that are being performed over and over again in a session, and they're a big win for click counters in your organization. Keep in mind, exploding sets appear at the top of the list of available diagnoses, visit charges, or procedures, and are indicated in bold text. So we've got an example here again of the pediatrics TDAP or DTAP demo, I'm sorry. And you can see, again, you've got the name, display name, and then we can add in diagnoses, procedures. You just highlight whatever one you want to add in here. And then you would just search for those items here. And then you would assign your groups right there. And then you've also got your items that we've added. So it looks like we've got some procedures, office visit, and then the problem code as well down here. So the other thing I want to point out is it's important to make sure all this stuff is ordered in the right, is basically put into the right order. You'll need to sit down with the coding and billing office so that basically when this stuff is submitted to your insurance company that you're getting the correct reimbursement. So it's important to make sure all this stuff is ordered in the right order. Next, I want to hop over to the Manage Groups tab. And then we're going to just go on and hop down to our pediatrician. And basically what we do here in Manage Groups is this is where you can assign the different groups that are going to be for a user. So you can see the pediatrician here already has pediatrics. So let's say we wanted to give them family medicine. So we'll just click Add to User Groups, and that pushes that right up there. If for some reason we wanted to make that the default, we just do the set as default. And then you can see right over here, you can also take a look what is assigned in each one of these groups. Just by clicking the view button here, it would show you everything that's assigned for this particular group. And then also just want to point out, it's important for like your billing staff, for those folks, make sure that they've got the correct groups assigned to them as well, so that they can work through any kind of billing stuff that they need to go through within the charge module. All right, so let's hop over to modifier groups and take a look at this. So only modifier groups that are assigned within the group will be available for selection by end users on the front end. It's also important to realize there's a large number of modifiers available across the organization. So you want to make sure that you only assign modifiers that are pertinent to the particular specialty. Otherwise, you're going to have a long list. It's going to be pretty hard for the providers to navigate through that list. So, yeah, obviously the modifiers for a cardiology practice are going to be different than those for, say, a podiatry practice. So let's take a look at podiatry. And then we can see we've got a few modifiers here. If I needed to add any more, I just click Add, and this is going to give us our entire list of CPT-4 modifiers from the CPT-4 modifier dictionary. And let's just say we wanted to add the 23 and say the 47 modifier. So we just click OK here, and then that's been added, and then we just want to save our work there. So now that we've taken a look at the group admin section, we're going to hop over here to dictionaries and take a look at the dictionaries that are associated with Charge. I've tried to group out the dictionaries for us today so that it's a little bit easier to understand where everything's at. We'll look at diagnoses, charges, dictionaries that are associated with diagnosis, dictionaries that are associated with charges, and then dictionaries that are associated with scheduling and billing. So the first dictionary I want to take a look at is our ICD-10 dictionary. And this dictionary contains diagnosis codes and data that is used to check whether a diagnosis is billable or non-billable in your practice management system. And it's generally loaded from your integrated practice management system using interfaces or SSMT. Dictionary entries are not enforced, and you can edit code name and mnemonic values and manually add entries as well. Okay, so now the second group of dictionaries we're going to take a look at is the charge dictionaries. First one we'll take a look at here is your charge code dictionary. And it contains charge and CPT-4 codes that are sent to the billing system via an interface once the encounter form is submitted. Some examples might include new patient visit or consultation. I'm going to go ahead and slide this up a little bit for us so it's a little bit easier to read. And the first item we've got there is the display name. This entry displays in TouchWorks EHR, but is not sent back to the practice management system. Administrator can use this field to change the name of the charge code to something more relevant for a physician or team user. And then we're going to move down here to Detail 2 and take a look at all these items right here. First off, we've got the charge type. There's several different choices here. We've got, first off, is consultation. That will prompt the user to select a referring provider if one is not specified on an encounter form. We've got enter manually. That prompts the user to enter a charge amount when a charge associated with this charge type is entered on the encounter form. Then we've got multiple units. This prompts users to enter a number of units for which to charge the patient. And we've got time-based, and this prompts users to enter a start or end time for the charge. And then normal, this is the default option associated with charge codes. This option doesn't prompt users for any further action. And then other also creates no prompts in TouchWorks EHR. And then we've got the CPT-4 modifier drop down right here. When needed, specify a default modifier for a selected charge code, and the CPT modifier can be used in cases such as where a single modifier is always applied. Then we've got the CPT-4, and this contains a valid Medicare CPT-4 value as collected by your practice management, and it's used for medical necessity checking. Then we've got right below that the interface code. This is used by your practice management system charge interface. And if no other value is entered, this field is populated with the charge code value from the code field when the Save button is clicked. Next, we've got this checkbox for visit code. Indicates that the code is for a visit. And then we've got the 25 modifier applies checkbox. I want to talk a little bit more about that. It's used quite frequently. So the 25 modifier is added to a visit charge to indicate that a significant separately identifiable evaluation and management service was required on the same day as a procedure or another EM service. The purpose of the 25 modifier is to say to the insurance company that the patient required a separate EM service above and beyond the included beyond that was included in the procedure. For example, if a provider performs an office visit and also performs some type of procedure, such as an immunization or lesion removal, then the provider records a visit charge and a procedure charge for that encounter. In this instance, the provider must also add the 25 modifier to the visit charge. If the 25 modifier is not added to the visit charge when reported with a procedure on the same day, it's likely the visit charge is going to be denied by the payer, and the physician office is not going to receive payment for that EM service. All right, let's take a look real quick at the detail 3. We've got the low age limit, high age limit, sex specific here, and basically these all kind of function the same. If the low age limit, if you have someone that's younger than that number that you provide there, it's going to give a warning to the provider. Same with the high age limit. If it's above the specified limit there, then they'll get a warning. And then sex specific, obviously, if it's for the charge is for a female patient and the provider selected a male, they'll get a warning. And then we have the dental charge. When this is checked, it indicates the charge code is a dental charge and requires more detail. All right, so let's hop over to the CPT-4 modifier dictionary and take a look at it. So this one also provides several nice features. They include visit modifiers, procedure modifiers, and modifiers for both visits and procedure codes. Because the CPT-4 modifier codes within your practice management are typically too numerous and complicated for physicians to remember, it's recommended to only add entries you expect your physicians at the practice to use. As noted, we've got visit and procedure and then both. So if you had something that was that needed to be labeled as both a visit and a procedure, you would need to obviously select the both here. Example of that might be chronic pain management that could be classified as a visit and a procedure modifier for, say, pain injections, whereas a microsurgery modifier would only apply as a procedure modifier. And then right below that, we've got the CCI modifier. And that is, if we check this box, that stands for Correct Coding Initiative Modifier, and this enables the modifier in context to be a selectable choice when the CCI edits option has been enabled. Tracy will talk a little bit more about CCI edit, the CCI preferences a little bit later in the webcast. Okay, so now we're going to hop over to the orderable item dictionary. Give it just a second here to load. And let's see, we've already got our CBC in context here, so that'll be good. We'll use that one. And first off, I want to talk about the display name. You don't have to use codes or names that are delivered by your practice management system. You can modify the display so that the wording is more in line with what users are familiar and comfortable with. For example, if the code is really for excision and drainage of a benign lesion, less than 2 centimeters by 2 centimeters, that's a fairly long display. So in that instance, it might be a good idea to modify or rearrange the wording so it's a little bit more user-friendly. But you want to keep in mind, again, this is something that if you change it, it's going to affect everything enterprise-wide. So you need to be careful about making those kind of changes. Make sure you've got the correct or the appropriate approval to make those changes as well. All right, so let's scroll down to the charge MN section. And we're going to talk a little bit about this section. First thing that we see here is the when to charge, and this is for our orderable items, obviously. So we've got a few different options in here. We're going to go over those. It includes never, on collection, on order, upon completion, and when resulted. So never means that a charge is not going to be applied to an orderable item. On collection, the charge is for an orderable item and applied when the specimen is collected. On order, the charge is applied immediately after ordering the orderable item. And then upon completion means that the charge will be applied when the orderable item is actually completed. And then when resulted indicates that the charge is applied to the orderable item once results are returned. I also want to make a quick note that anybody that's going to be doing the 15.1 upgrade, there's a new option that we don't see here today, but it's called immediately. And it works with both med and non-med, and that the charges on the encounter go in immediately once you click the commit button for that one. And so if a order or the charges will drop whether the order is in an active, complete, a hold for, in process, needs info, or result status. And then also one other note about the changes with 15.1, the on order that we just saw has been changed to on active. All right, so let's move on down to the CPT-4 code. This is for adding CPT-4 codes for medical necessity, and the CPT-4 code is only enabled when the field is set to never, when the when to charge field is set to never. And then right below that, we see the description. It's also possible to include a free text description of CPT-4 codes as an orderable item. And then we have right up here to the right, we've got the charge code, and this field, which is only active when the when to charge field is set to anything other than never, opens up a small window where you can select associated charge codes to an orderable item. So we'll change this over to on completion, and then go ahead and bring this up for you. We can just press the binoculars here. This will give us all of our different charge codes. So we'll just drop the first one in here. Actually, we'll do this one. Push it down with that click button right there, and then click OK. Now we see the charge code's been associated with this one. The item right below that is the admin initial charge code. That field makes it possible to add additional charge codes for the initial administration of medications. Options for this field are derived from the charge code dictionary. And then the admin additional charge code is much like the initial charge code. There is a field for, this is a field for designating any charges for additional administrations which can be entered into the admin additional charge code field. Next, I want to talk about some issues with charges not dropping to the encounter form. Now, while all of these options should help to streamline the charge entry process, we want to point out that there can be some issues with charges not dropping to encounter forms. Periodically, orders that are set to charge upon completion can cause a secondary encounter form to be generated. It's important to ensure that end users are aware of this, and they know that they will need to either submit both encounter forms or remove the items from the result charge encounter form and move them to the office visit encounter form and submit only that. This situation can often pop up when end users don't have the encountering context while completing an order. I also want to point out that it's important to keep careful records of orders that are set to charge throughout all this. We can't stress enough how important it is to keep careful records of orders that have been set to charge because codes can change yearly. Additionally, medications, vaccinations, and immunizations do change regularly, so keep careful records. Keeping careful records allows you to correct any setups that need to get modified. And the last thing you want to consider with the orderable item dictionary is it's important to note that CPTs marked as inactive in your practice management system will also need to be manually updated in the OID. That is, they need to be updated or deleted from any orderable items in the OID, and also inactivated in your CPT-4 modifier dictionary. All right, so that takes care of our charge dictionaries. Next, we're going to hop over to our scheduling and billing dictionaries. And the first one we'll take a look at is the division dictionary. So this dictionary contains various divisions used by the practice management system that's interfaced with TouchWorks EHR. Divisions can be thought of or used to indicate primary specialties such as internal medicine and primary care. Entries into this dictionary are mapped to physicians so that choices available on the encounter form are limited to a valid list of divisions. Next up, we'll take a look at the billing area dictionary. Typically, the division and billing areas are the same. However, consider this example. If your organization uses internal medicine as a division and then wishes to provide a distinction of all the specialties that fall under a field of internal medicine, such as say rheumatology or gastroenterology, they could use the billing area in this way. The billing area can be thought of as a way to identify subspecialties. Billing areas available for selection on the encounter forms are set up in this dictionary. Again, like divisions, entries into the billing dictionary can be mapped to physicians as well. Then we've got the billing location dictionary right below the billing area. This dictionary is built to contain various billing locations used by your practice management system. And again, like the division and billing areas, billing locations can be mapped to physicians. All right, so now we're going to hop over to the appointment type dictionary. And this dictionary contains various types of appointments used by scheduling systems that are interfaced with TouchWorks EHR. Some examples are new patient visits and physical therapy and acute. Once set up, the appointment type dictionary should be synchronized with your practice management system to ensure all appointment types have been set up and are working correctly in both systems. And as you can see, there are a few options down there that we can select, but we're not going to actually go into those today because they're beyond the scope of our presentation. Now we're going to hop over to the discount type dictionary. All right, the elements entered into this dictionary are used to indicate the type of discount a patient may be eligible for. As you can see, this dictionary is delivered empty. Some examples for that might include professional courtesy or clergy discounts. And then we're going to hop over to the encounter type dictionary. And the encounter type dictionary is where all encounter types are set up. Some examples of encounter types that might include appointment, message, telephone call, or other. And then some of the options within the encounter type dictionary to choose from. We'll take a look at two of those. The first one being can submit charges for the encounter type. Option specifies if an encounter type in question displays in the encounter selector when called from the charge module. So that's that one right there. And then the linked appointment right down here. Checking this option indicates that an encounter type will be created in the practice management system and will flow to TouchWorks EHR via the scheduling interface, though most clients prefer to use the encounter type entry of an appointment. All right, so three other dictionaries I want to touch on. We're not actually going to take a look at, but want to touch on these are the injury type dictionary. It's used to set up billing, special billing conditions such as workers' comp or auto accident. Then the injury context qualified dictionary, it's used to set up context for an injury. That is, did the injury occur at, say, school or at work or maybe at the gym. And then we've got the injury type qualifier dictionary, and it's just what it sounds like. It contains qualifiers for the type of injury, say, for such as assault or possibly burn or crushing injury. And the reason I wanted to mention those is because they're important to charge module for when practices might be required to submit types of information for special circumstances, such as those for workers' comp injuries or claims filed to a carrier other than the patient's primary insurance. All right, so finally I want to touch on the importance of syncing the practice management system and TouchWorks EHR. The reason obviously this is important is because if they're not in sync, you're going to get a lot of errors on your interface, and then those messages are going to have to be worked. The errors are going to have to be worked and corrected, which may require some build work in TouchWorks before those messages will actually go through. So it could, it's definitely going to possibly cause some effect on patient care because those messages aren't going to be going through. So the dictionaries that you definitely want to keep an eye on for that are the ICD-10 dictionary, the charge code dictionary, the billing location, area, and division dictionaries, the visit type, and the encounter type dictionary. All right, so I'm going to go ahead and hand this back over to Tracy now, and she is going to take a look at starting off with charge admin.
Thank you, Jason. And let me share my screen. Okay, so like Jason was saying, we want to go ahead and take a little look here at our charge admin section. And obviously, the first thing you want to take a look at is mapping your providers. So when we were in the front end, we looked at provider auth scripts, and you saw in there I basically had already mapped this gentleman out to charge demo division, the charge demo billing area, and the charge demo billing location. Now, those are all dictionaries that Jason took a look at earlier in the presentation, and this is where you can see where they come into play. So let's say we want to monitor our internist, maybe, and we need to add a division for him. Maybe we want him to be, we also want him to be in our charge division. Maybe we also want him to be in a billing area that corresponds to our office provider. But maybe in his case, he travels to multiple billing locations. So not only do we need him to be in the TouchWorks clinic, but we also need him to be at the main, and we need him to be in our demo location. So in that way, you can go ahead and add on multiple entries in any of these three subsections for any of your providers. Again, like Jason was saying, it is very important to make sure that you are keeping those these mappings in sync with your practice management system, or again, you are going to create errors that somebody's going to have to go in and manually work, which of course kind of defeats the purpose of using an electronic version of billing. One other thing I want to point out here, it's easy to just go ahead and navigate away from here and not quick save, and I've done this unfortunately quite a few times, more times than I care to admit. So make sure you click save before you navigate off the page. And it takes it a few seconds. It always goes to the test system, so it's a little slow. Okay, so that's how you do that. And then again, this is the information that's going to pop up over here. Let's go take a look at our encounter form real quick. Again, this is the info that pops in right here. So if we change this to maybe we want it to be an internist, you should then see we have more than we have more locations available for our internist than we had for our provider. So that's how that works. Yeah, we'll leave. Oh no. Well, here we go. All right. So the next thing I want to take a look at is some of our enterprise preferences. All right, and the first thing I want to take a look at, and Jason kind of touched on it earlier, is our CCI edits, or our correct coding initiatives. It's basically a program that was developed by CMS, or the Center for Medicare and Medicaid, and this, as most of you know, they represent about 120,000 pairs of CPT or HCPCS Level 2 codes that are not separately payable except under very specific circumstances. The key here with these CCI edits is to keep in mind that they are applicable to services billed by the same provider on the same patient on the same date of service. So those three caveats have to be met before these CCI edits are applicable. Basically, all Medicare claims, and of course there's going to be many other payer claims as well, that are processed against CCI edits. And as we know, what Medicare implements tends to be quickly adopted by other payers, and I'm sure CCI edits are going to be one of these instances as well. So basically all it does is it gives the customer, the customer, the ability to reduce the amount of claims that are under reimbursed due to correct coding initiative errors. If we think about it, checking these charge codes for CCI edit compliance up front is going to save you, the customer, a lot of time and money as compared with the current process where a lot of us are using that requires reworking rejected claims after the fact. So it just gets money in your pocket quicker and probably going to save you some time and energy and, of course, money on the back end. All right, the next thing I want to take a look at is our 25 modifier checking turned on. Does your organization want a 25 modifier checking utilized? Personally, I would think that would tend to always be turned on, but that's something you definitely need to work through prior to implementation in your planning process. The next one I want to take a look at is our free text referring provider turned on. You can do that here, yes or no. Again, this is something you need to think about ahead of time. You need to decide, are you going to allow providers to free text referring providers into their encounter forms, or do you only want them to be able to select from the referring provider dictionary? On this left side of allowing them to, the provider can quickly move through an encounter form population process and go ahead and move on down to the next patient. But on the downside, it means someone's going to have to go back and fix those edits. that are going to be created, and it's going to be a little more time consuming. Therefore, it's going to cost your organization either in time and or money. So either way, whichever your organization decides to go with, you need to make sure you discuss it and have a plan as to how to move forward. All right, the next one is the non-billable diagnoses code. Again, this is another organizational decision. You need to make sure you work with your providers and your support as well. But with the push to collect charges the first time go around, this is definitely a decision that needs to be presented to management. Compliance code field and default. So basically, administrators have the ability to set up compliance code. And I think Jasmine had a question in our Q&A section, and this has basically to do with residents and attending providers. So if you are an organization that has a lot of students, med students, and or attending that are coming through rotation, you might need to turn this on for specific documentation for billing purposes. Okay. The next thing I want to take a look at here is our medical necessity checking. So medical necessity checking is basically, it's related to your local Medicare review policy. So keep in mind this is only one option that needs to be populated for proper LMRP checking to take place. There's a couple things you have to do. So you have to, of course, set this option up here to the TS, and it's going to activate it for the charge piece of the application only. Not for the order piece, this is just for the charge piece. At least one of your insurances has to be flagged as a Medicare or Medicaid necessity insurance. The location field that Jason looked at earlier in your location dictionary can have to be linked to a specific payer. So you have to make sure you've got your LMRP payer turned on for the locations that you're looking at. And for medical necessity checking the state place and charge, you have to link a charge code item to a CPT-4 code. So obviously that's going to be like the trigger that kicks all this off. It's got to have a code to look at. The most important thing to note here is that LMRP it can be somewhat complicated. So these are points that are really high level that you need to keep in mind as you move forward. And there are obviously some little caveats here and there that can trip up folks when it comes to configuring and setting up LMRP, but these are the big ones you need to keep in mind. All right, so next below that we've got some specific options and preferences for ABN. So what is an ABN? It's an advanced beneficiary notice, and the purpose of the ABN is basically to give the patient advance notice that Medicare may or may not pay for a test or service that's been ordered for them. So when ordering tests or services that don't meet LMRP or local medical review policy or national coverage limitations, physicians should take the time to explain to the beneficiary or the patient why the test is being ordered and that Medicare may or may not pay for the test, and therefore the ABN has to be signed. So it's important that you are familiar with and you know the regulations when it comes to LMRP and ABN. One thing you can do here, you can set it to hold charges for your ABN status, and that's basically yes, no. And basically what that's going to do is when you set it to yes, it's going to change your charge status to meet information on your charge code on the line item in your encounter form, and it will create a managed charge edit task as well. So to complete the managed charge edit task, you have to go into the applicate or go into the encounter form, hit the needs info, and fill in the details of the failed medical necessity dialog box. If you set it to no, then the charges that fail medical necessity checking will not be held up. Instead, an ABN follow-up task is going to be created for the ABN to be followed up on manually. There's a few other things you can do here, and these are recommendations from Allscripts. If you do go ahead and turn on your medical necessity checking, they might recommend that you definitely use the GA modifier here, and it tells the payer, Medicare, and or whatever payer that the patient's using that yes, they find the ABN and they accept financial responsibility. And if you use the GZ modifier in this particular preference, basically it lets the insurance know no ABN was obtained and the patient did not sign that. So that's how those work. Next up, we have our encounter locking turned on and the timeout. Locking is going to occur at midnight on the last day of the specified lock countdown period. If you set this option to 0, locking basically begins when your charges are submitted. And the last one here is our H2C, for our hierarchical condition category checking. Okay, so this is a diagnosis grouping model that feeds into CMS. It's basically a risk payment program for health maintenance organizations. Medicare pays private plans to participate in MMC or Medicare managed care. A monthly capitation rate to provide health care services to enroll patients. And kind of a newer payment model. It's based on diagnosis classification called HCC. So you need to know what your billing office has set up with various carriers before you decide to make this HCC available. And again, if you remember back to our note, we saw a couple of those, a couple of those problems that actually displayed the HCC icon as well. So that's what's causing that to display. Okay, so while we're on this, let's hop on over here to our additional info. Additional info setup, it's a good way to gather specific code-related information on the encounter form that your billing office might need to actually go ahead and proceed to process the claim correctly. So one we've come in here and set up already is our LNP, and this is a pretty common one. So as you can see, maybe for specific codes or specific emails, maybe you need between the ages of 10 and 70. You want to capture specific information. So in this case, what we've done is we've asked it to pop up with a date if your patient meets these specific criteria. We want people who are obviously patients who are female and who are within an age range that this might be an appropriate question to ask. So again, these are the criteria you can utilize. You can set it to apply to the entire encounter, just specific charge. You can make it required. You, of course, can inactivate it. And you can make it display all the time or just when these specific conditions are met. So this is a great way to capture information for anything from maybe an NDC or a date last seen, a disability date, again, the LNP here that we're displaying, a prior auth number or a referral number. These are all instances where I've seen these used, accidents, anything like that. Okay, so that's how you create those. All right, now we want to take a look at a few preferences, and we're going to go back into the kind of the old school preferences here, and we're going to take a look at a few of these preferences. So I don't know if a lot of people actually come back in here and look around from time to time, but these are important to understand how these work. The first thing I want to take a look at is this one right here, which is our CW billing area required. And you can see, you can come in here and you can say this is going to be a yes, no. This is always going to be required. Is it going to be required at the system level, the user level, and or the device level? What's the default setting? And basically what this one is the user has to be able to save the encounter form. They have to indicate a billing area. And then the second one, the yes means that we're going to use the ones that are actually mapped in our charge admin that we just took a look at a few minutes ago. So another one, pretty important, is of course the division. Again, if this is something you're going to require and you need it for billing purposes, when it gets over to your practice management system, you need to make sure you've got this set appropriately. And one other one I think is pretty, it's used quite a bit. Let's like this one here. Where is it at? I don't see it right offhand, but there is a task or a preference in here where you can actually set the number of diagnoses that are going to be available or limit them on the encounter form. This is typically a numerical value between 1 and 10, and it just represents the maximum number of diagnoses that are going to be allowed by the provider and user to be entered onto the encounter form. This becomes useful in instances where specific insurers or payers, such as like Medicare or maybe Medicaid, only accept a certain number of diagnoses. And so by indicating a diagnosis limit, it doesn't let the provider go above and beyond that. So maybe they're going to have to be a little more selective of the 4, 6, 8 that they actually do add onto their encounter form. One thing that this also brings up that we need to keep in mind and consider is basically it'll pop up and it'll say you've reached your limits and that's all there is to it. So it just is a good way for you to communicate with the provider. Oh, there it is. It's a good way for you to communicate with the provider that there are specific items that can only be added, and this is the limit. One other thing to consider is if exploding sets or bills that exceed the diagnosis limit, you need to keep those in mind as well. So some of those might not get added to the encounter form if you've maybe got the set at 6 and you've already got 2 diagnoses included in your exploding set, and the provider's already got 5 diagnoses from the encounter form. Only one of the ones from the exploding set is going to get added on. So just keep that in mind as you move forward. All right. So there is one other preference under TW Admin I want to make sure we take a look at, and that is our Create Future Encounter Appointments, Create Future Encounter Preferences. Basically, this is a preference that determines whether or not the organization, you'll allow the organization and the end users to create encounters for future dates. Set it yes or no for organization. It's important to consider whether or not you want to be able to do that, to choose future encounters from the encounter selector. It can become an issue if the end users accidentally choose the encounter that's going to pop to the top of the list, which may or may not be the correct encounter and could possibly be for a future encounter maybe with a different provider or a different clinic. Accidentally choosing the future encounter and submitting the charges against the wrong appointment number can cause problems within the charge matching when it gets over the practice management system, because it's typically looking for that visit number. So that situation can kind of be avoided by setting the Create Future Encounter preference to no. And that's right here as well. So that's just definitely something you need to think about prior to implementation. All right. A few other preferences are located in TW User Admin. And take a look at our provider that we were just working with earlier. Find our guy here. All right. So there's something that you know, a little more real estate. Okay. A few things to keep in mind here is when we've got our provider set up, we can come down here and take a look at. First thing I want to make sure is that we've got our provider in question set up as a billing provider. So it's important to make sure that they're going to be able to populate the encounter form. We also want to make sure that once the provider is live on the charge module, we want to uncheck this box. By default, it's checked before they come onto the system. So we want to make sure that we uncheck this box. And basically what that does is it goes ahead and allows for the submit encounter form task to automatically be generated once the appointment is derived from the practice management system. And basically that task, like we were looking at earlier, is just a reminder to providers to complete and submit their encounter forms for each visit. I mean, we know most providers want to get rid of their tasks as rapidly as possible, so having one sitting out there for every arrived appointment is a great trigger and a great reminder system for them. The next one I want to look at is actually going to be located in these little preference boxes. And if we expand this out a smidge, I don't know that a lot of people actually come down in here a lot, but the very bottom section here, you can see right here, this is a really important one to keep in mind, and this is your Create Review Encounter Form task. So you can put this to always, never, or inpatient only. Typically what you're going to have to see is if you set this to always, the provider is going to be on what is called manual review. So it's going to go ahead and kick off this review encounter form task for somebody in the coding office to look at. If you set it to never, that's typically when you've got your person set on what's called direct submit. And then you're not going to generate any kind of review encounter form task. The encounter form is going to lock it. It's immediately going to flow on over to the charge interface. Inpatient, of course, has to do with inpatient. There are also, as you can see here, there's also quite a few other preferences you can set for your providers here on the back end. So maybe we always want to use these. Maybe we want to make them always display on the submit button. We want it to go right back to their schedule, or maybe we want it to go back to their task list. You can set these up on the back end for the providers, but they can also come in, and let me show you where those goes. One other thing I want to mention before it pops over to the front end, and I do this all the time, You come down in here and you make some changes, and I do this all the time. You make your changes down in here, and then you forget to come back up to the top and hit save. So make sure you go ahead and hit save before you get out of here. But if we take a look at this from the front end, as though we're actually the provider, and we navigate over to our encounter form, our charge module itself, we can set up some preferences here, and they can come in and they can change it. Maybe you've set this up for them on the back end, but they can always come in here and they can make changes as they see fit or for whatever works best for their particular workflow. One thing to keep in mind here is the auto-linking of diagnoses. Do you want them to auto-link? If you want them to do them all, diagnosis to all, primary diagnosis to all procedures, link all your diagnoses to all your charts, or you can set it to no auto diagnosis linking. It's important for the provider to make sure he understands that setting it to all is going to set this every one of these to every one of your visits or every one of your diagnosis codes to every one of your charge codes. The next one is display when submit button is activated. And that's right here. So at this point, they can decide where they want to go, where they want to navigate to as soon as they hit the submit button for each encounter. I think a lot of folks like to just kind of work all their charges at once. So in that case, they're going to move, they want to go back to the task. If you've got a provider who is really on this game and they're submitting everything as they go, maybe they want to go right back to the schedule and pick up the next person and move on to the next room. So it just depends on their preference. The next one here, you've actually got a few preferences that you can set for each specific tab, so they don't have to, you can set them all right here. This is basically where you want your diagnosis selector to go to. Do you want it to go to the master? Do you want it to go to the group build? Or do you want it to go to your favorites? Maybe before they get started, you know, when you're first starting with a charge implementation, they probably want to go to the groupings until they kind of get a feel for it. But a lot of folks get really comfortable with it, and they'll go ahead and they'll create their own favorites. They know what they see on a day-to-day basis, and it saves them a few clicks. They can do that as well. Of course, you can also control the display for these, and you can control the sort order and or the number of columns. And the same thing is applicable for both your procedure and your charge selector. Okay. All right, so that's how that works. So, all right, so let's hop back in our PowerPoint. Okay. Okay, so we're going to kind of wrap this up here. So let's actually take this a step further and take a look at how do we go about implementing charge in your organization. So first off, it's going to be very dependent on your practice management system and if you have any transaction editing software in place, or is there even anything available for utilization with the current practice management system you have in place. Implementation of this type of software may just adds a little extra level of automated logic to your claims processing. So it's important to make sure you understand your practice management system and your transaction editing system if you have anything. Make sure you get vendor specs for your interface messaging. It's really important to understand what is actually needed to process a claim for insurance, and you need to figure out how you're going to get that specific info out of the EHR and into your PMS. Make sure your interface message fields and you know how they work and how they can best be mapped between the EHR and the PM. Again, here's where your planning and testing is really, really going to be key and where it's going to come into play for you. You need to find out what type of edits can be written in the test, if that's any at all. The next thing to keep in mind is to gather all the super bills you can and convert to electronic format. I can't stress enough that it's important to grab all the papers you can from any department you're working with and really, really read over them and understand what's happening. Make sure you understand that and know the diagnoses and procedure codes, the modifiers they use. It's going to help the end users and with each department. It's going to help them with that conversion from a paper to an electronic format. You definitely have to get clinical input. I can't stress this enough, and I can't think of all the times that I thought I understood how something worked until I actually got out there and talked with some of the end users. And you reach out to those providers and the billing staff and anyone else who's willing to be involved in the process and who is involved in the process of actually submitting bills at this point in the paper world. It's always better to gather redundant information than miss a huge step in the process simply because you just weren't aware it existed. So make sure you get everything you can and talk to anyone you can. Don't overlook anyone. Again, after you've done that, you're going to go ahead and define and create your group. And Jason talked to you earlier about how to go ahead and create your group. If we're really lucky, sometimes the paper bills are already divided up for you and they're grouped in some kind of logical fashion. So you got a little bit of a head start. But if you're non-clinical like me, you're probably going to need some help at this point. So keep in mind, a cardiology practice is going to use a completely different set of codes than maybe an allergy or pediatric practice. So you need to understand how they would both logically group the applicable codes for any of those practices. We're going to have to ask for some feedback from your departments and to your reworking of your groups. And Jason showed you how you could actually print all that stuff out. So go sit down with somebody in the office, get some feedback, and have them evaluate what you've already got set up. And most importantly, it's really important to be creative when it comes to this process. And I've had people roll their eyes and kind of giggle at me like I've divided these codes up in some crazy fashion, but this is just because I'm not clinical and I've never been in that kind of setting. So it's great to kind of put the onus back on the end users of your organization, and it helps them feel like they've got some level of ownership in the process as well. All right. The next thing I'm going to talk about is organizational implementation decisions. So it's important to understand, are you going to bring this up after you've already implemented some of the other TouchWorks modules, or are you going to try and do it at the time of like a mass deployment? It very well may be that you've determined by the staff we have available to dedicate to the implementation process and or where your organization currently finds itself in the rollout process. There's no definitive right or wrong way to implement charge. However, the thing is to be sure you have sufficient staff to properly build, implement, and support the staff that's going to be utilizing the application, or you really risk losing some level of credibility within your organization. Your implementation strategy. It's important to understand, are you going to try to roll this out site by site, or are you going to try and kind of do it like by specialty by specialty? If you're thinking of going with a specialty approach, it might be a little easier on the back end for your folks who are building. Specialties typically use the same sets of codes, and obviously that's going to make it a little easier for the analyst who's doing the build work. And once you're completely through with one specialty, you can move on over to another. However, some organizations just aren't organized that way. Some sites might share personnel across specialties. You might have a pediatric practice that's also working in conjunction with a family medicine practice, so you're going to have to keep in mind from an end user perspective, it might be easier to do it from a site build than it is for a specialty build. So it may mean more work for the analysts and trainers, but it might be the most realistic approach for your organization, your specific stuff. Last thing I want to mention here is if you've got traveling or PRN staff, be sure to keep those folks in mind and address their needs with appropriate planning, training, and support. And make sure that they're getting everything they need as well. And again, as Jason mentioned earlier, we're talking about planning implementation. Probably the biggest thing is to work with your coding department, meet with them, sit down, look at all these current super bills, and make sure you run reports in the practice management system. I found that it's a lot easier to do these builds. You've got specific hard numbers you can reference back to, and you can use to kind of justify why you've made certain bill decisions to your management and or to the providers. I think a lot of times people kind of over or underestimate the number of cases or diagnoses they might see in a given time frame. So this just gives you hard and fast numbers to look at. Again, get all the clinical input you can. It's important to understand, to go out and maybe even walk around with the clinical staff and get all the help you can from them. Try and schedule some time to do a walkthrough, watch a typical session or two in the clinic. I have found personally that the staff is typically more than happy to help give you feedback, and they're already doing a large amount of the work when it comes to filling in and managing the paper super bills anyway. So take that time to find out exactly what they do, flow of the office. Like, for example, who is in the clinic that adds on charges for immunizations, for PPDs? Do they do B12 injections or depot injections? Are there nurse-only visits for wound checks? And how does the office currently bill for those visits in the paper world? And at this point, start thinking of how you can easily translate those kinds of workflows and those kind of visits into their electronic version. Next, it's important to understand your clinical and business workflows. You need to understand why people are doing what they're doing. Try to find ways that will allow workflows to be streamlined. When you're out talking with the staff, get their feedback on current paper processes and their suggestions on how to improve them. Many times, those are the folks with the best suggestions, and they can help point you in the right direction for easy wins with your providers and staff when it comes to streamlining workflows in an electronic format. And the last thing I want to mention here is it's really important to understand if they use any kind of dummy code or dummy providers for resource scheduling. I've seen a lot of people use nurse schedules, chemo chairs, things like that. So if they're using that, make sure you have built all those dummy codes out, and that you train providers and staff on the use of the alternative codes within the application, and make sure you have used some kind of consistent naming conventions. It just helps cut down the confusion, and it eases the training process. All right. With all that being said, there's a couple of other things we needed to just mention really quick that you need to think about during your planning process. Do you have any appointment versus non-appointment encounters? Do providers actually charge for visits versus maybe a lab draw, immunization, med admins, and or nurse-only visits? Do you have any of those you need to keep in mind? You need to build out in your appointment dictionary. Make sure you've taken a look at your visit type. Are there some that are non-billable? For example, maybe the PPD stick is billable, but the PPD read is not, or vice versa. Wound checks. Do those always get billed? Are they billed for nurse-only visits? Global visits for surgery follow-up. Maybe your providers use depositions, or they sign up on a variety of paperwork. So you might need to keep in mind, do you have any providers who do community outreach for nursing home visits? So it's important to examine how to best bill these types of visits, or even if they're eligible for reimbursement from carriers. Again, does your practice management system limit the number of diagnosis codes that can be submitted? We talked about that earlier. You need to make sure you understand how that works. How are your demographics actually feeding and your physical information actually feeding from your practice management system over to TouchWorks? Are there updates on triggers? Are updates only triggered across the interface on appointment creation or with the appointment arrival? You really need to know how your particular practice management system files these demographic updates and what is considered a trigger event. Again, it's really important to test. And as Jason had mentioned way earlier in the presentation, this is a really good way to, and a really good time for modification and standardization. I think you're going to find when you get out there that many departments have developed their own workflows and processes that you and many others across the organization are completely unaware of. I've personally seen many practice managers and administrators who had absolutely no clue what their staff were doing on a day-to-day or even patient-to-patient basis. This is a great time and great opportunity to standardize and streamline across the organization. And the last thing I want to talk about are just a few miscellaneous items. You need to have a plan in place, or at least start the discussion on how you're going to go about collecting copays. Something that's going to be done there at the office. This is going to be done at the time of checkout. How's that going to be worked out? You need to look at user favorites. Who's going to build those out? Is it something you can copy and push out via SSMT? Inpatient. Does your clinical organization do any kind of inpatient visits? It's going to vary greatly across the gamut here. Some places collect technical fees, some professional fees, some facility fees. So just make sure you understand how that works. Make sure you've taken a look at task views. Who's going to be reviewing them? Who's going to be doing the tasking? Who's going to be getting these assignments? Those sort of things. Again, you need to discuss with your management and your providers about preferences that we listed out earlier. Make sure you keep a good records of your orders that Jason looked at with your OID. When are these things going to charge? Are they going to charge upon completion? How are these going to work moving forward? Who's going to help update with codes? That sort of thing. And what are you going to do when it's time to update or deactivate codes in the practice management system? I know this for me personally, when I was a client, it had become a big issue. So I know going forward, this is something you need to kind of have a plan in place, and you need to have some mechanism to say when October 1st rolls around and it's time to switch over codes, how are you going to make sure that all those previous old encounter forms and or appointments have been billed for appropriately with those codes, and then switch over to the new codes on the next day. So those are all things you need to keep in mind. And what time are we at here? Oh, we're 3:25. Okay, so so I know this is a huge amount of information, and it was a really short time frame to kind of absorb it all. But we hope it's been beneficial to you and your organization moving forward. I think we've really kind of run out of time to do any question and answers at this point. So what we'll do is we will be sure to let you know if we've got any of your questions that are submitted. We'll go ahead and we'll post the presentation with the wiki and, of course, any answers to those questions that you've submitted. Again, we know your time is amazingly valuable, and we appreciate your choice for spending this afternoon with us. So if you have any questions or would like to speak with Jason or myself, please feel free to reach out to either of us or anyone else at Galen. We would love to get you and your organization set up with Charge. Hope you all have a wonderful weekend and enjoy your holiday season. Thanks, everyone.